The doors slam open, cold air flashing lights, the metallic scent of blood. A young pregnant woman is wheeled in, unconscious and fighting for her life. Dr. Ethan Hale doesn't know her name. Not yet, but something about her face stops him mid-step. One heartbeat, one breath, and a memory he's buried for years claws its way back. Because what's about to happen in this trauma bay will tear open his past, test his skill, and lead to a Christmas revelation he never saw coming. Where in the world are you watching this right now? Tell me in the comments. The automatic doors burst open, letting in a gust of cold night air and the wail of the departing ambulance. She was wheeled in, her face pale under the harsh fluorescent light. One hand clutched protectively over her belly even in unconsciousness. The ER breathed in, then started shouting. "Trauma Bay 2, a nurse called. Clear that hall." An orderly barked. BP dropping, someone shouted from the gurney. He was already in motion before we even knew his name. Gloved hands snapping, eyes scanning, moving as if the room arranged itself around his stride. He caught the side rail as the gurney swung toward him, matching its speed without breaking step, like he'd practiced with gravity itself. "What do we have?" he said. Not loud, but it cut through. 29-year-old female, MVC, unrestrained T-bone at high speed. 32 weeks pregnant, unknown prenatal care. The MT rattled off, his voice skittering around breath. Pulse thready, BP 80/50, GCS 8. No obvious external bleed. Belly's tense. Lines, he said, too large bore. Hango negative, keep it warm. Fetal heart tones now. Respiratory, prepped for intubation. On it, said a nurse at his elbow. Dr. Hale, Ethan. Another nurse corrected under her breath, but he didn't react. Dr. Hale moved like he belonged to the rhythm of the room, to its metallic scent of blood and antiseptic, to the slick floor and the beeping machines and the cold chrome that reflected a man who didn't look away. A gloved hand parted the woman's hair. Blood matted dark at her temple. A shallow scalp laceration wept sluggishly. Her eyelashes trembled and stilled. Her free hand twitched toward her belly, fingers splayed over the taut curve. He leaned in, the light haloing her face. "Stay with me," he said, softer. A breath the monitors couldn't hear. Her eyes fluttered, an involuntary flick, iris showing for a ghost of a second. He didn't realize he'd been holding his breath until it came back to him, cold as the air. "Intubation tray," he said. "Propofol and suck. Respiratory. Right here." He took the laryngoscope as if it were an extension of his own precision. Jaw thrust. Cricoid pressure. "Good. I'm in." He slid the tube. First pass secure. The monitor's oxygen numbers climbed as if coaxed by his certainty. Capnography confirmed. "Tape it." "Foley," asked a nurse. "Hold for now. I want to know about the baby." He pivoted, left hand hovering at the woman's sternum, feeling the brittle tremors of a struggling heart through gloved fingertips. "Fetal Doppler?" "Got it," said Sam, the charge nurse, pressing the probe low and left. Silence hissed through the gel. "Move," Hale said, gentler than the word. The probe slid. The monitor caught a heartbeat. Fast, frantic gallop, 165. "There you are," he murmured, to a patient too sedated to hear. To himself, maybe. "Her abdomen's rigid," said another nurse, fingers probing. "Could be abruption." "Labs, trauma panel, type and cross 4 units," he said. "Ultrasound to trauma bay. And someone get OB on standby. If she dumps her pressure again, you're taking her to the OR," said Sam. Not a question, an acknowledgement. They all knew where this could go. Dr. Hay, the EMT who'd ridden in, hovered at the edge of the light. She had a bag. We found something. "Later," he said, eyes on the number. "Now BP 78/40. Sam's voice ironed out thinner. "She's fading. Push a liter," he said. "And get me TXA." "Now, TXA going," said a nurse. Voice steady, hands smoother than speech. 2 grams. He leaned close to the woman again. Her skin smelled like cold air, radiator heat, the ghost of rain and the singed plastic of airbag deployment. His thumb brushed a smear of dirt on her cheekbone. The gel shivered on her belly. The monitor chirped its frantic reply. "She's bleeding somewhere we can't see," he said. mostly to the room. "We need the ultrasound." "Rolling," said a tech, shoving the machine through the stuttering traffic past the nurse's station. He didn't look up. He didn't look away. It was a discipline, that stare. He had built it on nights like this, out of the ashes of other nights when he'd blinked and something had slipped away forever. The room smelled metallic, like a coin sucked into a mouth. The ceiling lights were knives, and then, "Doctor," Sam said. She held out a small, damp envelope found in the woman's bag. His name was written on it. Dr. Ethan Hale stared at his name in someone else's looping hand. Paper wilted from rain or tears, and for a second the room became far away. "BP dropping," someone said again, as if that magic phrase might snap him back. He didn't touch the envelope. Not yet. He turned back to his patient like he always had, as if nothing had ever mattered more or less than this one moment. "Ultrasound," he said, and the machine arrived. Still, the envelope waited, small and wet and undeniable. He didn't reach for it. He reached for the probe. "Fast exam," he told the tech, his fingers guiding even as the tech set the gel. The monitor unfurled, grainy black and white, the dark lakes of fluid voids, the white ribs like a barred gate. "Free fluid in Morrison's pouch," the tech said, voice tightening. "Right upper quadrant there, a crescent of darkness pooled where it shouldn't be." "Internal bleeding," Hale said. "Get me a surgical consult." "No, scratch it, that's us. Prepanor. Notify Ob, this is going to be a joint." "Ob on their way," Sam called, already 2 steps ahead and pretending she wasn't. He slid the probe lower. The uterus ate the screen, curves and shadows, the flicker of motion within like a tiny fish shifting in a black pond. The baby's heart fluttered, fast-wired. 158. Sam said from the Doppler, relief surfacing in the numbers. Still holding Hale's breath, eased half an inch. "We're moving." He nodded to the anesthesiologist, who had materialized as they do, summoned by the alchemy of crisis. "Get her ready to roll." He pressed the probe for one more angle, seeking something he didn't have language for. The shape on the screen. An arc of spine, a hand unfurling and then curling again. It was ordinary. It was a miracle. He felt the shape of an old ache rise in his chest, one he had taught himself to listen around. "Ethan," the anesthesiologist said, "we're losing the line in her right AC. Veins collapsed." "Left antecubital," he said, half aware of the old nickname tossed by a ghost, Dr. Machine. He took the catheter himself. "Tourniquet. Tap the vein where it still gives." "Good. Flush." "Got it," the nurse said, impressed despite herself at the way his hands claimed kinetic permission from a body in collapse. "Dr. Hale, Ob is scrubbed and ready," a clerk called from the doorway. "Give me 2 minutes," he said. "We stabilize a little more before we move." He bent again toward the patient, now stabilized in a thin bubble of numbers that could pop if someone thought too hard. "Stay with me," he said, again softer. It felt like the same breeze that had blown the envelope into the room. Her eyelids fluttered again. It was nothing. It took him years to understand nothing could be everything. Her lips moved beneath the tape that held the endotracheal tube. A murmur rose through sedation and tube and noise. He leaned close, and she whispered raw, "Than his name." Under the hiss of oxygen, mouthed like a familiar word she had not expected to need. It struck him harder than the monitor alarms ever had. His heart did something he would deny on any form. "You know me," he hadn't meant to ask. He asked anyway, "Can you hear me?" Her lashes trembled. A tear slipped from the corner of one eye, collected at the tape, made it curl. He wiped it away with a gentleness that didn't feel like his. "Move," he said to himself, to his feet. "We're going to the org." They rolled. The corridor a tunnel of 2 bright lights, ceiling tiles whizzing past. The walls held holiday decorations put up by volunteers. Paper snowflakes, a tinsel garland that had gone crooked near the nurse's station, a handmade sign that said joy with the O drawn like a stethoscope. It was the season of forced cheer and real miracles, and here he was in its throat. "Clear the elevator," Sam called ahead, a voice like a siren without the pitch. The doors opened. They jammed in. Someone's elbow hit the call button for 3 instead of surgical. "Hey!" Sam snapped. then softened with the micro smile that meant she would pay for it later with chocolates. Third is Niku. "Don't worry, little one," she murmured to the belly. "We're not there yet." In the elevator's cramped mirror, their faces looked like a movie's, focused, washed out by fluorescent light, eyes rimmed in fatigue. His own reflection startled him. The set of his jaw, the notch above his brow that deepened when he was failing to think of anything but the next step. He looked toward the gurney. A necklace had slipped free of the woman's collar. The chain kinked where the EMTs hadn't noticed. A small charm hung against the hollow of her throat. A silver lily, petaled thin as a wish. He had given a charm like that once to someone he had no right to think about now. His chest went tight. The elevator chimed. They pushed into surgical. In pre-op, Ob arrived, a brisk, steady woman named Dr. Chow, her eyes wise and kind in a way that made bad news feel less like a blow. "Placental abruption possible," she said, assessing in a single pass. "We'll be ready for emergent C-section if maternal instability worsens or fetal tracing dips." "She's actively bleeding in the abdomen," Ethan said, his voice finding its angle. "We'll do an exploratory laparotomy, control the hemorrhage. You monitor the baby. If the baby tanks, we pivot." Dr. Chow nodded. Agreed. She looked at the patient's face, paused. "She looks familiar," she said mildly. "Everyone looks familiar when they're in trouble," Ethan said, too fast. "Not like that," Dr. Chow said, but she let it go. Surgeons choose their own cliffs. They moved, scrubbed, gloved. The ritual settled over him like the cool of winter air. He could breathe inside it the way he hadn't known he was suffocating. When he stepped into the ore, it smelled like iodine and warmed fluids and nerves burning sugar. Sam clipped the envelope to the chart out of the way, and conspicuous like a truth pinned up so it wouldn't be lost. The handwriting looked like spring, looping, a little untidy, as if written fast and with feeling. He kept not looking at it. "Time out," he said. The team paused to confirm the patient, the procedure, the plan. Calls echoed around the room. "Female 29, exploratory laparotomy, Ob on standby." "Knife," Ethan said. He cut with the pressure of someone slicing into necessity. The skin parted, the subcutaneous fat a pale yellow that still surprised him. He worked without hurry, without hesitation. The suction hissed and went red. Blood welled, and it wasn't all his doing. "Bleeding from the spleen," he said, suction carving a window. "Possible grade 3 laceration." "Packing." "Packing," echoed the scrub nurse. "Hands a choreography of gauze." "BP 76/40. Anesthesia called." "She's clamping down. Hang another unit," Sam said, already spiking it. "Fetal heart rate creeping down," Dr. Chow said. 140, 138, calm voice, loaded words. "Almost there," Ethan said. He could feel the room tilt, time angling steeply, decisions racing downhill. He did what he does, held it together with a line through the center of his attention. "Hemostasis," he murmured, seeing the way the torn edges slicked with blood that kept finding its own way out. The little silver lily necklace cupped a drop of sweat below the patient's collarbone. He had learned to not see things. Tonight, the edges of that discipline frayed. "Ethan," Dr. Chow said. 1:30. Decelerations. 5 more minutes, he said. "I can give the baby a better mother to be born into. BP 68 systolic anesthesia. She's running out of curve." He packed. He clamped. He sutured a ragged edge. The bleeding slowed, then steadied. It would hold if he asked nicely. "Okay," he said, throat dry. "Close what we can. Abu 120. Dr. Chow said, relief sliding into a tone, holding for the moment. The moment stretched thin and iridescent, and then the ore lights caught the edge of the small envelope clipped to the chart, illuminating it like a stage prop meant for a wider audience. When they finished and the wound was dressed, when the numbers stabilized to something the monitors didn't whine about, and the anesthesiologist nodded once, Ethan stripped his gloves, the snap echoing soft as rain. He reached for the envelope. His name looked stranger up close, as if it had been written while the writer's hand trembled. He slit it open. Inside, a single photograph, worn at the corners, and a note folded in quarters. In the photograph he was younger, not by much but with a carelessness he had long since put away. He stood beside a woman at a street fair under yellow lanterns. The woman held a paper cup of apple cider with both hands. She wore a silver lily at her throat. The woman in the bed, his heart climbed into his mouth and stayed there. He unfolded the note. He read, "I didn't know how else to find you. If I made it this far, I guess I have to say it out loud. He deserves to meet you." The note didn't sign a name. "Transfer to ICU," Sam said gently, like she hadn't seen his face turn to glass. "We have a bed. Odd wants her on continuous fetal monitoring." He slipped the note back into the envelope. He could have said 1,000 things. He said none of them. "Let's move," he said. Voice scraped down to the bone. As they wheeled her out, a glint caught at her wrist. A hospital bracelet, of course, but beside it, a thin red thread knotted 3 times. He had tied one like that once, on a different wrist. He remembered the words whispered to seal the knot, for protection, for keeping, for finding your way back. He had untied his years ago. On the hallway to ICU, the lights seemed too bright, the tinsel too eager. Outside a window, snow began, first tentative flakes melting against the black glass. The season of return. He had not planned to be found. The monitors in ICU blinked in winter colors, blue numbers, green lines. The woman lay tilted slightly to her left, a pillow wedge under her hip, to ease the weight of the uterus off the vana cava. Someone had tucked a warm blanket up to her chest, leaving the surgical dressing and the swell of the baby uncovered for the monitor belt. "Fetal heart 142, the nurse said. "Nice variability." She looked at Ethan, then at the envelope he hadn't let go of. "You okay, Doc?" "Fine," he said. The word's edges were too sharp. "We keep her warm. Fluid steady. Watch urinary output. Page me if her belly gets more rigid or the fetal tracing dips." "Got it." The nurse checked the IV pump with the tidy ruthlessness of someone who had earned her competence one night shift at a time. "She's Maya rays," she added, reading the chart. "No allergies listed. One emergency contact with a disconnected number. No prenatal care in our system. Self-pay. Maya." The name unfolded like a bruise. He hadn't known it then by the lanterns. Or he had, and it belonged to a moment and not the years after. He stepped closer to the bed. Her face looked different without the adrenaline of the ore cutting its profile. Softer, tired. She had a faint scattering of freckles across the bridge of her nose. A small scar at the corner of her mouth. The kind that comes from falling off a bike as a kid or smiling too hard at life. Her hair was darker than in his memory, or maybe the same, and the light had lied. The silver lily lay against her sternum, weightless and heavy. Dr. Chow appeared at his shoulder. "You look like someone kicked your history out from under you," she said. "Not unkind. I have an envelope to prove it," he said, which wasn't an answer. "How's she doing?" Dr. Chow asked the nurse. "Stable," the nurse said. "Urine's light but present. Scent. Fetal heart is reassuring, no contractions yet. We're watching for preterm labor after trauma." "Good." Dr. Chow touched the blanket at Maya's shoulder, a light human gesture in a field of machines. "Page me if anything changes. We're not out of the woods. We just know where the trees are." When she left, Ethan remained. He took the chair that is always there in ICU rooms, the one meant for husbands and mothers and daughters, and sometimes doctors who don't know what else to do with themselves. He didn't open the note again, because he couldn't unread it. He didn't look at the photograph because he already had. He watched the line of her eyelashes where they lay against her cheek. He remembered her eyes open for a second in the trauma bay, and how they had dragged him years into the past unspooled with a mercy he didn't deserve. He had been a 4th-year resident then, sharp as a wire, tired of being bent. He'd gone to the street fair only because Sam had made him leave the hospital for an hour. "Touch some air," she'd ordered, human and immovable as weather. He had wandered past paper lanterns and cider, and a band whose drummer was a little too earnest. He had stood in a corner of the world where no one needed anything from him, and that had frightened him. She had spilled cider on his shoes. apologizing with a laugh that looked like she liked the person she was apologizing to. He had said it was fine. It had been more than fine, and he had run from it anyway, because the night swallowed people and he only knew one way to keep them from swallowing him too. They had walked for an hour. They had found a parking garage that overlooked the river and the lights. She had told him she wrote grants for community health projects and believed in things that don't hold still long enough for scientists to measure. He had told her nothing that mattered. He had given her the lily charm that came in the mail from a cousin he never saw. A thoughtless, intimate thing, ridiculous and perfect. They had kissed once, a kiss that tasted like apple and cinnamon and futures he couldn't face. He had not taken her number. He had told himself he was saving them both. Now he knew what he'd been saving and for whom. Maya's fingers shifted against the blanket, a small twitch. He stood. Her eyelids trembled, then lifted. Sedation receded like a tide, leaving the shore of her face bare and vulnerable. Her eyes met his. Recognition flared, confusing itself for surprise. Her pupils dilated, less from the light than from the flood of something she had held alone. He swallowed. "Aye," it came out hoarse. "You're in the ICU. We took you to surgery. You're okay, the baby is—" The word snagged. "Oh, the baby," she said. And the relief that passed through her face almost undid him. Then quieter. "You." He hesitated, because it seemed both cruel and necessary to stay inside the generic. "I'm Dr. Hale. Ethan, his name fit differently here. You were in a car accident. Do you remember?" "I remember brakes," she said. "Lights," her voice wavered, then caught itself. "I remember thinking, don't let me hit anyone. Don't let me hit." She looked down at the swell of her belly, at the monitor strap like a belt keeping the night from falling. She exhaled. "The baby's okay for now." He forced his voice to be the thing she needed, steady. "We'll keep watching." She nodded. The movement made the tape at the corner of her mouth pull. He adjusted it gently, and her eyes flicked back to his, with the quick, involuntary gratitude of someone who had learned not to expect gentleness. "I wrote you," she whispered, eyes slipping toward the chart where the envelope now lived in plain sight. A flush climbed her cheeks, shockingly alive against the whiteness. I didn't think I would see you like this." "Neither did I," he said. He put his hand on the blanket where hers lay beneath. "Not touching, not touching. We can talk. Later, when you're stronger." She looked at their almost touch. Something in her steadied. "I didn't come to ask for anything," she said. "I came to tell you. In person, if I could." His throat worked. "Tell me." Her eyes filled and she blinked hard. There wasn't supposed to be an accident," she said, the smallest laugh breaking into air like glass. "I was going to wait until after the holiday. I thought, New Year, new." She stopped and shook her head, a suggestion of a smile at her own attempt to make a shape of it. "It doesn't matter. We're here." "We're here," he echoed. Her belly tightened under the belt. The monitor traced a contraction, a soft hill, tentative and early. Dr. Charles Pager would sing in a few moments. Ethan watched the line with a fear he didn't have to hide. "Are you in pain?" "Everything hurts," she said, "but not like before. Before I was scared. Now I'm—" She considered the ceiling. Still scared, but different. The door opened, and the room reset itself around necessities. Dr. Chow came in, her expression reading a story only she could edit. "Hello, Maya," she said, her voice a gloved hand. "I'm Dr. Chow. Your baby is watching us very carefully and judging us as they do." Maya laughed and then winced. "Tell him to be nicer," she said. Him, Ethan thought, without meaning to. The word landed like a match that didn't catch it. Dr. Chow glanced at the contraction tracing. "You're having some contractions. That can happen after trauma. We'll give you fluids and something to relax your uterus if needed. We want to buy the baby more time." "Okay," Maya said. "Please." They adjusted the drip. The hill on the monitor softened. The baby's heartbeat trotted onward. Dr. Chow's eyebrows unfurled a notch. "Good," she said. When she left, Maya turned her head toward Ethan, slow as forgiveness. "Do you still hate the holidays?" she asked. He blinked. What, you said they were like glitter, she said, voice drifting. They get everywhere and you're finding them months later in places you didn't intend to find joy. A ghost of a smile. There was a little boy at the fair with a candy cane stuck in his hair. You said that was a warning. The memory crashed into him with the solidity of a wall. He had said that. He had not told anyone else. Something in his chest thawed painfully. I don't hate them, he said after a beat. I don't hate everything about them. Maya's eyes softened. I didn't plan this, she said. I thought I would see you and it would be hard. But it's... Her voice blurred, the monitor bleeped steady, her eyes slid closed. I'm tired, she murmured. Don't go, do. I'm not going anywhere, he said, meaning it and not knowing how to. He stayed until his pager tugged him away for a consult on a gallbladder that had chosen the worst possible week to revolt. When he returned, the midnight hours had turned the windows into mirrors. The tinsel down the hall glinted like frost. The fetal heart monitor hiccuped once and then steadied, like a practice run at panic. Sam slipped in and looked at the envelope, at him, at Maya. Her eyebrows asked a question her mouth didn't. You look like someone watching a storm find the house he once owned, she said, not looking for a reply. He held up the photograph. Sam inhaled between her teeth. Oh, she said. Oh, I didn't know it was her, he said. It sounded inadequate even to himself. You didn't know it was anyone, Sam said, not cruelly. But maybe you did. She looked at the fetal monitor. I can sit if you need coffee. He shook his head. He didn't need anything that wasn't this room, and the woman breathing inside it. After 2 a.m, the contraction tracing began to knot itself more often. Not labor, not yet, but a rehearsal with new confidence. The baby's heart rode the practice hills, dipped, recovered. Maya stirred, winced, breathed. He coached her without thinking. In through the nose, out through the mouth. Good. Like the river, she whispered. He frowned. What at the garage, she said. You said the river only looked still. It was always moving, but no one noticed unless they watched very carefully. Breathings like that. He didn't know whether to laugh or grieve. He did neither because the room asked him to be present, and he knew how to obey. Toward dawn, a nurse came with a basin and a warm cloth, and wiped Maya's face with the tenderness reserved for the sleeping. Maya's eyelids flickered. When she opened them again, Ethan saw a decision move through them like a shadow shifting. Ethan, she said. Then she stopped, because alarms can be personal even when they are mechanical. The fetal monitor chirped high, steady, then hesitated, the line flattened a hairbreadth. Sam shouldered the door in with her hip. Tracing went null for a second, she said. Could be the belt slipped. Reread it, Ethan said, already checking the belt. He adjusted, found the heartbeat again. It galloped, dizzy with relief. He exhaled. Maya's shoulders sank. Sam looked at the red thread knotted on Maya's wrist. What's that? She asked, curious. Maya's fingers touched it. A promise, she said, almost smiling. One I kept and one I didn't, before anyone could ask. The contraction tracing curled higher than it had all night, and the fetal heartbeat stumbled under it, like a dancer tripping on the hem of a dress. Decel, Sam said, down to 120, 110. Dr. Chow appeared as if the room had said her name 3 times. Breathe with me, Maya. Good, Ethan. I'm here, he said. Baby doesn't like these longer contractions, Dr. Chow murmured, watching. We'll try position changes. Fluids up. If decelerations persist, we may need to consider. Consider what? Maya asked. But she knew. An anxious laugh that wasn't a laugh fluttered. It's too early. Sometimes we don't get to choose the page, Dr. Chow said softly. We just show up for the story. The next contraction climbed, the deceleration steeper. Maya's hand flailed for the rail. Ethan caught it before it found emptiness. Her palm was dry and hot. Stay with me, he said. The same words, a new anchor, another decel, 198. That's it, Dr. Chow said, that specific tone that meant we're done being reasonable. We're going. Or, Ethan said. They moved. The hallway lights were too bright again, and the elevator doors knew when to open without being asked. Snow clung to the edges of the windows like cauterized lace. Someone had left a plate of gingerbread on a nurse's station with a note that said, "For whoever needs the next miracle more than sugar." The scrub tech shoved the C-section tray into place. Sam tightened her ponytail. Dr. Chow strapped the monitor to measure what mattered until it wouldn't be needed anymore. Ethan glanced at Maya. Her eyes found his through the crush of preparation, as if they were in an empty room. "Tell me later," she whispered, fierce for someone so close to breaking. "Whatever you're not saying, I will," he said. The anesthesiologist adjusted the block, dosing carefully. Maya's body quieted below the ribs, then her face tensed anyway, because fear is not in muscle. The ore lights hummed. The fetal heartbeat did its small, brave thunder. Dr. Chow lifted her hands, waiting for the moment that would become the moment. "Time out," someone said again. The room exhaled. "Scalpel," Dr. Chow said. "Wait," Ethan heard himself say without knowing why. He looked down at Maya's wrist. The red thread was catching on the tape, cutting into her skin. He reached and loosened it, then retied it in 3 careful knots. "For protection, for keeping, for finding your way back," he said, without meaning to say it aloud. Her eyes filled. "You remember," she whispered. "I remember," he said. "Then don't forget this," she said. "He deserves to know the sound of your voice." "Who?" Sam asked, too softly for it to be for the chart. Maya's lips parted. She shaped a word like a gift she'd finally decided to give, and then the monitor screamed. The scream wasn't human, but everyone felt it in their bodies. The fetal heart rate plummeted, a cliff you couldn't pretend was a hill. From 100 to 90 to 75, tacky Brady, and then just Brady, like a bird slamming into a window. "Crash C-section," Dr. Chow said. But the call was already moving without the words. "We're going now." "Confirmed," the anesthesiologist said. Eyes checking levels, hands ready for speed over elegance. "Prep wide," the scrub tech said, already handing instruments like he could see between seconds. "Ethan," Dr. Chow said, concise. "I'm in. You're with me." He stepped into the space at her side, the one that counts as sanctuary. He knew every movement here. His hands knew even when he didn't. He looked down at Maya's face. She watched the light, not the ceiling, as if it was something alive. "It'll be fast," he said. "Hold on, stay," she whispered. "I'm not going anywhere," he said. "This time a promise, and not just a phrase." "Incision," Dr. Chow said, voice low as a line drawn through glass. The scalpel kissed the skin. She cut through time, through fascia, through the white of rectus sheath that always looks like a bleak sky. Retractors, a uterine wall shone at them, muscle and purpose, and the future's last thin door. "Low transverse," she said, and made the cut. Blood pooled, not volume, but color. The smell shifted. Iron, iodine, amniotic fluid, sweetness that always surprised Ethan, an immortal hint of salt like early ocean. "Head," Dr. Chow said, reaching. There, the baby crowed against her hand, the tiny skull stubborn with life and difficulty. Suction. The fetal heart monitor clicked away at 70. 68. "Come on," Ethan whispered, "because sometimes science needs a charm." Dr. Chow's hands were deft and decisive. "Shoulders," she said. "Cord around the neck." "One loop, too. Reduce it," Ethan said, seeing her already doing it. She slipped the cord over with a tenderness that made the word surgical feel insufficient. "Push," she told Maya, though the block had made her body uncooperative. "You won't feel it, but push anyway." Maya made her face fierce and bore down with her breath. "There," Dr. Chow said. The baby slid free, slippery and uncommitted to a decision about life. He was small, the blue-white of someone who had been asked to show up a little early and found the party too bright. The cord stopped pulsing sooner than Ethan would have liked. He cut it fast, handed the baby to the waiting pediatrician, whose hands were gentle and ruthless. "Come on, kid," the pediatrician muttered, drying, stimulating, suctioning. The room went still inside its speed, that particular quiet that is just a charged waiting. The baby didn't cry. Maya's eyes were oceans. "Ethan," she said, voice a ripped whisper, "say something he didn't think." He just spoke like he had 1,000 nights ago to a different silhouette against a different light. "Hey," he said, and his voice cracked. "Hey, little guy, it's time. We've been waiting." The pediatrician paused a heartbeat, just long enough to not interrupt whatever the universe was trying. Sometimes it takes a third thing to bridge a gap, not force or instrument, but sound. The baby inhaled, a fragile, stubborn gathering. He let it out in a thin, furious cry, the sound of a question asked and answered. "Upgar's 6 at 1 minute," the pediatrician called. Then, "We're working. Come on, kid. 7, 8. Maya sobbed once, one whole body sound, and then made herself still. "Yui." The monitors on her side applauded in numbers. Ethan's hands trembled, but only where no one could see. He watched the baby fight for the air that hurts and saves. He watched the pediatrician draw lines through charted boxes. He watched Dr. Chow make the world whole again below the drape, suturing the uterine wall with a patience that looked like love. "Let me see," Maya said, breathing as if she had run a race that no one else had noticed. "Just a second," the pediatrician said, not unkind, eyes darting faster than kindness liked. "We need to help him a bit more. He's early. We'll bring him right back." Maya's fingers flexed at her sides, helpless against the measured mercy of spinal anesthesia. Ethan slid his hand into hers, felt her grip find him, and hold on like no one had taught her not to hope. "He's okay," he said, because it was true, and because she needed the truth to calm down enough to carry other truths. "He's small. He's a fighter." "He sounded like you," she said, a watery laugh. Annoyed, he laughed too, an exhale that let all the other breaths follow. He hadn't noticed the knot in his chest until it eased. The pediatrician lifted the baby for a half-second, letting Maya see. A shock of dark hair plastered to a small skull, a mouth opening as if to argue with the terms of existence. A fist threaded around the edge of a blanket like a person who meant to hang on. Then the baby moved. The pediatrician moved. The moment moved with them out of the room and down the hall to Niku. The door sighed shut. Dr. Chow looked over the drape. "You did it," she said to Maya. "He did it. Now we do our part." Maya nodded. Her eyes found Ethan's again. "Tell me," she said hoarse. "Before I sleep." Tell me now. He knew what she meant. He had known since the envelope. He had known since his name dragged itself through the tape on her mouth. He had known since the red thread. Sam was very interested in the suture count. The anesthesiologist checked vitals with perennial focus. The room had ears, but generous ones. Ethan opened his mouth. The words stuck. Not because he didn't have them. He had nothing else. But because they would change time in an irreversible way, and he had spent years perfecting the art of reversible moments. "Doctor," a nurse said, stepping in a rush that didn't fit the lull. She held out a small zip bag. "This fell out of her jacket pocket during transfer. We meant to give it to you. It's sorry." I looked. It was open. Inside was another note, smaller than the first, folded into a triangle like kids used to pass in class. His name on the outside again. Inside 3 words. "I tried twice." His skin prickled. He looked at Maya. She smiled with embarrassment and apology. "I went to the hospital 2 months ago," she said. Voice small. "You were at a conference. The nurse said you were important, busy. I left before I said anything to anyone else. I didn't want to start a thing I couldn't finish. I went again. You were in surgery. I wrote you anyway." She swallowed. Maybe the universe wanted me to stop pretending I could control the how. Control. He had built a cathedral to it. He had knelt in it. He had waited for a mercy it could not provide. "Maya," he said. He said her name like they were all human here. "It's me." Her eyes didn't widen. They softened. "I know," she said. "I wanted to tell you when I could see your face. When I could see if you had that look from the fair, like you were funny and didn't think anyone would notice." He laughed, because he had no other defense against the way she said the word funny. He had been a lot of things since then. He hadn't been that. "Ethan," Dr. Chow said mildly, not looking up, "if you two are going to have the conversation I think you're about to have, please note that I am doing delicate work." He swallowed, nodded, found Maya's hand with a certainty that startled him. "I need to say it," he said. So say it, Maya whispered. The door opened. The pediatrician stuck his head in, eyes bright and tired. He's pinking up, he said, and the whole room let a breath out at once. CPAP for a bit. Likely a few days in NICU, but he's a stubborn one. Maya closed her eyes for a brief, violent prayer. Thank you, she said, to the pediatrician, to the room, to the season, to whoever handled requests this late. Ethan turned back to her. The moment was here again, wearing a new face. Maya, he said. That night, don't make it sound like an apology, she said, suddenly fierce. If you're going to regret it, wait until I can stand up. He blinked, then smiled without his permission. I'm not apologizing for the night. I'm apologizing for the years after, she breathed, a half sob that was also a forgiveness. Then tell me the thing that isn't an apology. He didn't look at anyone else. He didn't ask himself if this was the wrong place, the wrong time. He had always found reasons to be late to his own life. Not this time. He opened his mouth, the lights flickered. Storm, faulty wiring, the theater of coincidence, then steadied. The monitor bleeped its endless argument with silence. Dr. Chow tied a knot, tidy as a future. Ethan said, Maya, Doctor. Sam whispered from the doorway, holding a printout the NICU had shot down the hall. She looked like she had found a buried train track under the snow and was listening for an approaching sound. You should see this. He wanted to tell her to wait. He wanted to close the door between worlds. He wanted to be just a man for 60 seconds. He took the paper. It was an admission bracelet sticker with a barcode and a name printed in small, uncompromising letters. Infant male, mother, Maya Ray's father. Below it in black marker, someone had written a last name. Not Ray's, not blank. Hale. Sam's eyes widened. They asked her when she checked in the chaos. She must have said it, or someone. It's not legal. It's a sticker. It'll change with paperwork. But Ethan looked at Maya. She looked back like a person who had been brave alone and was tired of it. Her face said yes. And also, I didn't want it to be this way, and also, please don't run. He put the paper down. Maya, she squeezed his fingers. Say it, she said. I think I'm... He couldn't finish because the overhead speaker crackled and called his name. Dr. Hale to Trauma Bay 1. Dr. Hale, Trauma Bay 1. The ear did not care about hearts in straight lines. He closed his eyes for one beat. He opened them. I have to... Go, she said. We've been practicing waiting. He hesitated. I'll come back. Sam took the paper, tucked it under the chart. Sir. Dr. Chow didn't look up, but her voice softened. Don't take too long, she said, as if she had seen entire marriages pivot on bad timing. Ethan leaned down. He didn't kiss Maya because there were lines he respected in rooms like this. He touched his forehead to hers. A primitive, pure contact that smelled like iodine and breath. I'm not going to let you do this alone, he said. I know, she said. He left. The hallway felt different now. The decorations didn't seem ridiculous anymore. They looked like attempts. He ran. Behind him, Maya stared at the ceiling lights until they stopped being stars. When she closed her eyes, she saw a parking garage under paper lanterns. A boy with a candy cane in his hair. A man who had looked at her like she had arrived in the middle of a life, and he was surprised to be grateful. She saw a river, always moving even when you forgot to notice. The door slid and a nurse, young, new, serious, stepped in with a small bundle wrapped tight enough to keep the world from getting in. He can't stay long, the nurse said quietly. But he needs this first hello. The baby made a sound like a question mark. Maya reached for him, with a body that finally remembered who it had been for. The nurse laid him on Maya's chest above the dressing, below the tangle of lines. He was warm and indignant. Maya inhaled his hair. He smelled like milk that hadn't happened yet, and rain that hadn't fallen, and the future, the future, the future. Hi, she whispered into his small, startled ear. We're going to be okay, little one. Your dad. She stopped, because the word was whole and she didn't know where to put it. Your dad is stubborn. He'll find his way back. The door swung open again. Sam stood there, cheek shining with a tear she swore was sweat. He will, Sam said. Maya nodded, eyes a river. Outside, snow thickened until the world rested under it like a secret you could finally say aloud. He made it to Trauma Bay 1 in time to shout and save and stitch. He did the thing he was famous for, or at least the thing his colleagues said at parties like a compliment. He was unflappable. Inside, he was all flags. When he came back, the empty hallway hissed its white noise blessing. He scrubbed in a sink meant for surgeons who couldn't bring the outside into the inside, water hammering over shaking hands until they remembered their purpose. Isu again, the door again, the smell of plastic linen, antiseptic and hope again. Maya was propped, her skin so much more alive than when he had first seen her under the unkind fluorescence. The red thread glowed against the tape. A bassinet had materialized beside the bed, warmed and humming, empty now but humming like a promise. "You left," she said, and her voice wasn't an accusation. If anything, it was a relief put into words just to get it out of the air. "I came back," he said, "because some lines should be said aloud even if they are obvious." Sam slipped past him with a conspirator's smirk that pretended it wasn't fond. "I'm going to check on Niku," she said, like a line in a play meant to give the leads the stage. Ethan stepped closer. He touched the back of the chair he'd sat in earlier. He didn't sit. He wanted to be angle and height, not rest. Maya watched him with a steadiness that had less to do with morphine and more to do with the person she decided to be when the world wasn't supervising. "He's beautiful," she said. "And loud, and he already hates being swaddled, so you're welcome," he smiled. "He'll learn. Or we will." She looked at his hands. They were nicked and clean and still trembling at the edges. "You can hold him," she said. The invitation a bridge laid plank by plank between them. "I don't." He stopped. He almost said, "I don't know how the oldest lie." He almost said, "I shouldn't, the second oldest." He swallowed both. "Yes," he said. In nurse, maybe the same one who had smuggled hope in earlier. Maybe all nurses were one person at this hour. Slid in and then out again with the baby. Swaddled. Cipe prongs nestled like a silly mustache, monitors sticking like polite barnacles. He fussed until he found Maya's voice stilled, then fussed again to prove he had agency. When the nurse settled him into Ethan's hands, the room tilted. He was warmer than a person so small should be. He weighed the exact amount of a year that didn't exist yet. His eyes slitted open, dark and disbelieving. Ethan felt something in his chest break and not hurt. "Hey," he said, because that had worked once. "We've been waiting." The baby considered him as if time were negotiable. Ethan's vision blurred, and he pretended he could blame it on sleep deprivation. He brought the baby closer until his cheek almost touched a cheek too small to risk with stubble. The baby's mouth opened and closed, seeking. Instinct mocked caution with its ease. "He's got your eyebrows," Maya said. A grin hitchhiking on a grimace as a contraction she didn't need to have pulled anyway. "Expressive. And your stubborn mouth," he replied, shocked by how easily you arrived. They were silent for a while, a kind beyond the ore demands. Machines sang their pointless song. Unaware they kept people from drowning. Somewhere down the hall, a carol leaked from a volunteer's tinny phone speaker. It was the kind of song he'd mocked out loud and liked anyway when no one was looking. "I think I hate and love this," Maya said. Eyes on the baby. That it took an accident to arrange this conversation. That we've said more in 24 hours than some people say in 24 years. "We had helps," he said, nodding toward the envelope on the tray table. It lay open now, not a secret but a step. And we had practice at pretending we need less than we do. "Speak for yourself," she said, a smirk that was more fragile than it wanted to be. "I am a champion of needing." He laughed. It felt new, like muscles found after a cast comes off. "Teach me," he said. He meant it. It sounded like a joke, but it wasn't. He felt the truth of it strum something in him he hadn't tuned in years. Her eyes softened. "I can," she said, "if you'll admit you're funny." "Rumors," he said. Unverified. They let the softness sit for a minute until it became part of the furniture. "Maya," he said finally, because he couldn't not. "I need to say it, not because of forms, Because of me, because of him. Because otherwise I'll fold it into a story that lets me stay in rooms where I never have to explain myself. She watched him like a person watching someone step onto ice. Her hand found the red thread and rubbed it as if it itched. Say it. His heart beat like it had someone to keep up with. He looked at the baby. He looked at Maya. He looked at the space between, measured it in breaths and stepped. I'm his father, he said. The room didn't change. The walls didn't break and the ceiling didn't cave and the monitors didn't applaud. But something in him eased, like a joint that had been out of place sliding back into its socket with an honest pain that promised a different kind of movement. Maya exhaled in a way he'd never heard. Relief, grief, victory. Yes, she said, a laugh in the same syllable as a sob. Yes, you are. He let his head drop for a second, the way a runner folds at a finish line not because he's tired, but because no one taught him how to receive joy. When he lifted it, the baby had kicked free of the swaddle with one foot, the tell of a future argument about socks. What happens now? He asked, the way people mean it when they've admitted they don't know. Maya's mouth tilted. Now, she said, you tell me he has your eyebrows again, and I pretend it's a compliment. You tell me you're scared. I tell you I am too, but also stubborn. We fill out papers. We go to the NICU together. You bring me terrible hospital coffee, and I hate it less because you carried it. We figure out the rest later. We allow later. He made a face that would have been a flinch if it had stayed. I'm scared, he said, surprising himself with how easy it was to tell the truth aloud when the truth had a tiny, impatient mouth. Not of him. Of time. Of wanting something and having to be bad at it first. Of not being perfect immediately, she supplied, fond and sharp. Of being human where other people can see. He nodded, grateful for being read. He had run from rooms in which he could be seen. He didn't want to run tonight. I don't expect perfect, she said. I expect you to show up, to not decide for me what I can carry, to let me be mad at you when you deserve it and not run away, to let me be kind to you when you don't. He looked like someone receiving a prescription he hadn't realized he'd been waiting for. I can do that, he said. And then, because he had learned to be careful with promises, I will try. You can tell me when I'm not. Kindly, if possible. Possible, she said. Not guaranteed, he grinned. The baby snorted, a tiny derisive sound that no one should judge. Ethan's hand steadied under the blanket, a motion he could do forever without accreditation. Sam knocked and then ignored her own courtesy and came in anyway. Niku cleared you too, she said, waving her badge like a wand. Short visit to see His Highness. No paparazzi. Some cords. Try not to steal any expensive equipment. Wouldn't dream of it, Ethan said, and meant it only as much as anyone in a hospital with a newborn means anything but the next 12 minutes. They rolled. The bassinet hummed. Maya's bed hummed. And if their two hums matched key, it was because some engineers in the past had mercy in mind. The hallway stretched like a decision made human. Nurses smiled with their eyes. A janitor in the Santa hat saluted them with a mop. The elevator made its soft bell sound that could be about grace if you were in the mood to hear it that way. Niku was a world inside a world. Quiet and bright, the light of winter morning without the cold. Tiny people slept in plastic kingdoms under the keep of machines. Parents leaned like prayers. Ethan felt the fragile dignity of the place settle on his shoulders, a weight and a peace. They found the baby in his assigned starry corner. The CPAP trailed like a tiny elephant trunk. His hands had fought free again. A nurse charted with the ferocious attention of a historian. He's a strong one, she said softly. Already likes to argue with me about what resting means. Maya drifted a hand into the incubator through the porthole. The baby's fingers sought hers and closed. Something in the air clicked like a clock that had been paused, starting again. Ethan reached through the other porthole, hesitated. The nurse nodded without looking like permission granted. He touched the back of the baby's hand with his index finger. The skin was thin, unbelievable, alive. The baby's grip didn't include him the way it had included Mia. Not quite, but it acknowledged him as a person worth considering. He would take it. "Hi," he whispered again, "because sometimes all you do is repeat the spell until it becomes true. He swallowed around the joy like a marble. "I'm your dad." The word was a switch flipped, a current finding its wire. In the glass reflection, he saw his mouth say it and believed himself. They stayed as long as is always too short. When it was time, the nurse had to coax them away with promises of later. Maya left a handprint ghost on the plastic, a smudge that felt like evidence in a case she'd finally won. Ethan lingered a second longer, eyes on the rise and fall of a chest the size of his palm. He counted breath. Back in ICU, a volunteer choir parked itself by the nurse's station and started a hesitant, sincere version of Silent Night. Sam groaned and then, against her will, hummed. The tinsel's stubborn shine made sense. Ethan helped adjust Maya's blankets like he had practiced. He did not. "I need to call someone," he said. "I need to call my mother and say a thing that will make her cry in a way she will be mad about later. I need to call my own heart and leave a message." "Do it," Maya said. "Start with the mother, then the heart. Then someone for pizza that isn't the hospital cafeteria, eventually." He nodded, then didn't move. "Can I?" He stopped, because he didn't want to ask as a visitor. He wanted to ask as a person who had the right to be here and not have it revoked by a bad day. "Can I stay? Not in the room all night. I know the rules, but right outside, in the chair that makes your back older. I'll be there when you sleep and when you wake." She looked at him for the length of a small song. "Yes," she said. He sat finally, the chair making its objection known. He let it. He had earned 100 of these chairs and none of them had mattered. This one did. He leaned his head back against the wall. The ceiling seams were good company. He closed his eyes and didn't sleep. He listened to the room breathe, the whoosh of air, the beep-beep of lives measured, the whisper of linen when a nurse who could levitate moved past. Maya dozed, waking sometimes with the small panic of a person whose body still thinks it's in a car. Each time he was there, each time he said, "It's okay," not like a command, but like a weather report. Each time she believed him a degree more. Around 3 in the morning, she stirred and turned her head and found him already watching. "When he's older," she said, voice rough with sleep, "we'll tell him about the fair. About the candy cane boy, about the lily in the river and the elevator that stopped on Niku by accident and gave us a prophecy." He smiled into the dark. "We'll tell him about the envelope," he said, "and how bad we both are at timing, and how good we are at stubborn," she countered. "And how his mother," he said, "is the bravest person I have ever met." She made a face. "Don't do that," she said. "You fight rivers for a living." "I patched them," he said softly. "You carried one." The silence after that wasn't empty. He woke with a start to the small and undeniable sound of the dawn. Mask straps loosening, curtains being drawn back, a new nurse's voice. He hadn't meant to sleep. He had learned it was fine to do what bodies insist upon when the emergency passed, without asking him to be its hero. Sam stood in the doorway with 2 coffees and a smile that had decided to be ridiculous as a gift. "Mary, whatever you celebrate," she said. "I brought contrition." He took a cup. It was terrible. It was perfect. They walked down the hall together to Niku later. A small procession of 3 that would be 4 when they were allowed to be 5 with the baby and the nurse's quiet nod. Ethan carried the ridiculous coffee, the envelope, and a new shape to his posture he couldn't have named. At the Niku door, he stopped. "1 second," he said, turning back to Maya. He reached for the red thread and touched it like a relic. "For protection," he said, "for keeping, for finding our way back, even when we forget where we were going." Maya held his gaze so steady it made the morning bright. "We won't forget," she said. "We might get lost, but I know the smell of your coffee. I know the sound of your voice," he laughed. It sounded like him. It sounded like someone who had finally found a way into his own life. Inside, their son stirred, a small complaint against being asked to breathe. He breathed anyway. He would keep breathing through nights and alarms and seasons and the years that laid down like unrolled ribbon. Ethan stepped into that ribbon. He would learn the knot. He would tie and untie and ready until his hands smelled like milk and antiseptic. And whatever hope smells like once you admit it has a body. He leaned over the incubator and said the word again, because it kept working, because it kept opening doors. "Hey," he whispered, "I'm your dad." The baby opened his mouth as if to argue, then closed it as if to concede. It was in its way the first of many compromises. Outside, the season went about its show of soft light over hard ground. Inside, 3 people practiced being a family, badly and beautifully and for keeps. The machines kept time. The envelope lay open and empty on the counter, having delivered what it was made for. There would be forms and fights and nights, where he would want the piece of a trauma he could fix with a clamp and a stitch, instead of the ache of a question you answer by staying in the room. There would be jokes at the fair years from now, and a kid with a candy cane stuck in his hair for some reason that would make both of them laugh until they had to sit down. There would be the river, always moving, whether or not they felt themselves moving with it. Tonight, there was a room humming and a red thread not fraying, and a word that had finally found its place. He said it one more time, low, for himself as much as for the small person with opinions. The nurse smiled without meaning to. Sam rolled her eyes and wiped them anyway. "I'm here," Ethan said. "I'm here," and he was.